out. Okay, we will turn it on over to you, and we are here, of course, uh, to be able to help and facilitate as far as moving through items, and with our and we're ready anytime you are.
First, thank you for that. And for people who don't know me, I'm Eileen Barrett, and good morning. And I'm so sorry that I am here instead of Martin, who we all is feeling better and feeling like himself and has an easy course. And I know that you know that the work that we're doing here is, it is so important. It is so timely, and I am so grateful to all of the staff and all of the volunteers. There's a lot going on for a really long time, and it makes it even more important that we express gratitude when we have it, in addition to small kindnesses. So I hope that everybody has unexpected kindnesses in their day, and I also wish to thank all of you. Moving forward, I think that I'm sure that you saw on the website that we did have, in addition to the materials from the last meeting and the materials moving forward, that there is also the agenda as listed for today. And although the agenda doesn't look like there is it doesn't look like it's very long, there's always really, really robust conversations. And so with that, I wonder if maybe what we'll do, looking as our first item, is maybe a brief introduction of everybody who's here. You heard me, you heard my name, and maybe I actually don't use WebEx enough to know if people move, if everybody looks at the same names going across the top, the way with Zoom they move around. And I don't know. So
they definitely
maybe,
move around.
okay, then maybe I'll do just calling on everybody, and maybe just for one quick thing is if people are able to say if your name, your role here, where you're calling in from today, and maybe what is the best place to get a burrito in New Mexico. Okay, so start thinking, smart people. All right, so I'm going to say the best place to get a burrito. So I'm Eileen Barrett. I'm the vice chair today. I'm in Alberta. I'm going to go easy. I'm going to say Golden Pride on Central, but Lomas, excuse me. But I am, see, that shows how loyal I am. I even said the wrong place. But now, no pressure, but we're going to go to Gary French.
All right. I'm Dr. Gary French. I'm the medical director here at the Medical Cannabis Program. I'm sort of the B team here. Libby typically is running the meeting here, but congratulations to her. She's got a new baby girl. So yeah, so she's out on maternity leave, and hopefully she'll be with us next time. But I would say Harry's Roadhouse. You know, I haven't been to too many burritos, but I used to live out that way, and I always had a great meal there. So that's what I'll recommend.
That's a really, really good one. Good choice. And how about Dominic?
Good morning, everyone. I'm Dr. Dominic Zerlo, and I'm the Medical Cannabis Program Division Director, and here to support the committee in the work that you're doing. And as far as for best burrito, that's really a tough one, but I can't remember the name of it, but it's the place down in Hatch where you also get the green chili, and they've got all kinds of UFOs and other kinds of like statues and everything all around it. And I just can't remember the name of them, but they have the most fantastic burritos that I've ever had. Their burgers are also really good too, but I can't remember their name.
Sounds like it's time for a field trip. And colleagues, before we go to the next people, I want to ask for your forgiveness and your permission. First, forgiveness is that I'm referring to people by their first names. I hope that that is okay. And one of the reasons is to build community. However, I am going to ask everybody to continue to say your title, because I think it's often for people to know. So if your honorific is doctor, then please feel welcome to say that. And I'll thank you for indulging me on that. And actually the last thing, what I should have said was also pronouns. And mine are she, her, hers. So I'll ask if people can also say those as well too. And I wish that I had asked that from the outset. Sorry. And with that, then our next person, Andrea.
Good morning, everybody. Andrea Sundberg. I'm the health program manager. Pronouns, yeah, she, her. And I'm the break glass in case of emergency person. So I do our database, our stats, and I often text people in the middle of meetings with the numbers, so that's how they sometimes get those so fast. Oh God, best burrito. Oof, that's a tough one. But I gotta go classic. I gotta go with the pantry. The pantry is one of my favorite places, and it's been since I was been coming here since I was 18. So yeah, I'm gonna go with the pantry. Now I'm gonna have to go to the pantry for dinner. So and it's all your fault, Eileen. So thank you.
I will
And
happily
as far
take
as
credit for
terms,
that.
I do prefer the term goddess. So if anybody wants to refer to me as goddess, I'm okay with that. Especially Chris Woodward. He has to refer to me as goddess. So yeah. Thank you all.
Thank you. Thank you. And Eleni?
Hi, good morning, everyone. I'm Dr. Eleni Bukovalis. I'm an emergency physician practicing in Albuquerque, and I'm calling in from Placitas today. She, her pronouns, and the Warrior gas station in Bernalillo has amazing breakfast burritos for like $2. I will go out of my way if I'm driving home after a night shift to stop there and get one.
I like it. And then next, Mateo.
Hi, I'm Matthew Pearson. I go by Mateo. I'm a research associate professor at UNM's Center on Alcohol, Substance Use, and Addictions. I'm an addictions researcher. I'm also a vegetarian, so best burrito for me is at Annapurna's breakfast burrito, green chili, no cheese.
Excellent, thank you. And Matthew.
Hey, Matt Clark. I'm the Emergency Services Director down in Otero County. Best burrito down here. I really like the Lake's green chili cheeseburger. Or, sorry, breakfast burrito. I got lunch on my mind.
They're both good choices. Thanks. Chris?
Hi, I'm Chris Woodward. I'm an attorney with the New Mexico Department of Health, and I worked with the medical cannabis program for many years. And my pronouns are he, him. And I don't know if it's the best. It's the category where it's breakfast burrito. Is that right? Breakfast burrito, or just burrito generally?
I'd say just favorite burrito is our category.
I could really spend some time eyeing and umming over this one, but uh, I'm gonna say there's a little burrito stand in Santa Fe, not far from my office, called El Chile Toreado, and it is sort of catty corner to Tiny's restaurant if you're ever in Santa Fe, and it's a little hole in the wall burrito stand, and they have excellent and very plentiful burritos. So that would be my choice, I think.
Thank you. And Katie.
Thanks. This is a lot of fun. I'm Dr. Katie Wickowitz. I'm a professor at UNM, also at the Center on Alcohol, Substance Use, and Addictions, and a member of the committee. And she, her pronouns. And I'm checking in here today from the East Mountains outside of Albuquerque and Cedar Crest. And I would say my favorite burrito is actually at our Triangle grocery store here in Cedar Crest. They're monstrous and delicious, but my favorite green chili on burritos when that's together is Horseman's Haven in Santa Fe by far.
Way to take it to the next level. Thank you. And Kathy.
Go ahead,
It might be
Kathy.
that
Thank you. Yeah, I was muted. Hi, I'm Kathy Algeri, and I am the Department of Health IT Services Division Project Manager supporting the medical cannabis program. Pronouns are she, her, and favorite breakfast burrito, I'm going to go with Twisters.
Okay, I like it. Thank you. So I want to thank everybody first for going with it, right? In addition to being here, and people were jumping around. I believe that I hit everybody. I feel terrible if I missed you. If I didn't call on you, would you unmute yourself now? Introduce yourself, your pronouns, your role, and also your favorite burrito.
You did get everybody, Eileen.
Oh, okay. Thank you so much. Thank you so much. Okay. So, and with that in mind, then, now that we have that, then I think we might delve, although I would say that's part of the business, we'll delve a little bit more into the business on the formal agenda, since that wasn't on the agenda, which is that if we may hear our update from the medical cannabis program.
Perfect. Thank you. And so this is Dominic. I'll go ahead and share my screen. What we're really going to be doing from here forward, I know in the last couple of meetings we've done PowerPoints, but those don't really show you how our data is gathered and disseminated. So what I really just wanted to do is show you, based on our website, how we're posting data and other information right now. And then we can go through, of course, any particular item. So let me, can people see my screen at this point? It should show, okay, perfect. I see head nods. Thank you. Let me, there we go. Trying to, sorry, every time I share the screen, then the window that everybody is in suddenly minimizes. So I'm trying to expand that a little bit so I can still see everybody. So this is our program website, and we do have a page specific for the Public Health and Safety Advisory Committee. So hopefully you all have visited it at some point. You all are as well on it. We do have your biographies linked here in that first paragraph on it. And so we have the information here for everybody who needs it. And to be able to come in and see what information is coming up as far as like meetings, agendas, the links, and then also any latest activities. So right now, so far, what we do have is the recordings for the meeting that we are also putting out as well, including any other information. So you'll see we also included back in the meeting in April, the regulatory determinants of cannabis outcome survey that was discussed a little bit. We included that here so that even if you do miss a meeting or something else is happening or you have reference, you have a place and a location to go and easily find it. So that's the first part with regard to that. The other side is one of the other pages that we have is our educational materials resource publication and archive. And I know that's really long, and that is going to get split into two different pages moving forward. But the information, and I think it'll be pretty understandable as to what goes on what page. Essentially, our educational materials will be on one page, while the other items will be on a second page that's more data driven rather than just educational materials. And to give you an idea of what we're doing is we are creating different educational materials for the program and for others to be able to utilize. And as an example, I'll just pull up the, and I hope this still shows on the screen. There we go. Is everyone able to see it? About safely store your cannabis? Oh, perfect. And so we're creating all these different kinds of flyers. Some of them are small, so they're more of like a quarter or an eighth of a page, so that they're easily handed out in various settings such as schools, community organizations, community settings, things like that. As well as large posters. This happens to be our large poster that is both in English and Spanish. So, and all of our materials, by the way, are being produced in both English and Spanish. Sometimes we may have the English version up first while we're waiting for the translation, but then the translation is on its way. And so we do have many different items here. I'll give you another example. This is the edibles. So this, again, this is the smaller version so that people can have it as a really quick reference guide that talks about what are edibles and, you know, little bits of tidbits of information. We do also have the information as far as use. So for example, this flyer about if you choose to use, so discussing some of the potential issues, concerns, when people, for example, should call to for medical assistance or for other assistance, about knowing their serving size, especially with regard to edible products, some with storage, polysubstance use, and also,
Dominic,
oh,
can you hold
yes,
there?
I'm sorry?
So I think you want to correct something under the mixing.
Okay.
It says using one substance at a time is more likely to result in the experiences you want to have. I think,
Hmm.
like, oh, one at a time. Okay, sorry.
Right.
I was
But
assuming it was polysubstance use was more likely to result in the experiences you want to have, and I was like, oh God. No,
right. And,
but okay,
and if
I get it. Okay, that was a little
no,
confusing.
not a problem. And it is one of those things too, where for some people it may be the experience they want is influenced by more than one substance. So that is a little bit, for some people that may not necessarily be 100% true, but
No,
really
I'm sorry,
looking at
I read it wrong
no, no,
though.
you're fine. But having things like that, and it's actually something that as these are out there, we of course will make revisions. And if people do let us know that things are confusing, we will do that. We have passed them on. And so that it's good to hear, especially when items like that come up, because we may need to simplify the language a little bit. So we'll actually show it to a few other folks and see if they get the same or similar response. Um, but we are on a regular basis creating new materials. So, for example, one of the items though that we have had quite a lot of response on has been this just quick reference guide, which really just goes through what the medical program versus the adult use program, what some of the differences are, similarities, and it is actually a bit lengthy because it is 2 pages. But this is something that we've had a lot of people, especially law enforcement, who have responded back saying this has been very helpful. And I say that because this is actually the most recent edition of what we've done for many years, especially with regard to first responders, with providing them information. We just updated it and really need to give a lot of shout out to Andrea and Kathy, who are both on this call, for a lot of the work that they did with regard to this, because they really went through and added the information about the adult use side and making sure that everything that we were doing was correct and accurate for the information being passed on to all those individuals. But this originally was done and designed specifically for first responders and law enforcement. And now we've actually created it in a way that it is useful for general public as well. So I feel like we've continued to move forward. So you can peruse through those at your leisure. They are all on this website. Again, it's within the main medical cannabis website, just on the education material resource publication and archive page. And in the past, what we've also done is we've done a PowerPoint on all of our data. I'm not going to do that because the data doesn't change all of that much from one meeting to the next. But what I will show you is what we're doing in the monthly report that we produce and put out on this same page. And so it includes all of the information, including the active number of enrolled patients. So as of the end of May, we were at 135,388 active patients. It breaks it down by their primary qualifying condition, including the charts and data tables both, active enrollment by county, and so also showing the full counties, both by map and again in data table. And then some of the demographics, which, as I think I've mentioned before, we are improving the demographics because in the past, for example, the gender question was the singular gender question. We only started using the two-part gender question a couple of years ago, so we're still trying to gather that information to make enough so that it's actually, we can actually utilize it. And quite frankly, I feel that our any genders being expressed outside the not the binary genders for the purpose of our survey are not adequately represented right now for our actual true patient population. So always keep that in mind when we talk about the gender data at this point. I don't think that it is yet at a point where I would rely on it myself. So, but we're getting there because we instituted it just over 2 years ago. This next year will be the end of our 3-year cards, which means at that point people will be re-enrolling again. And so we'll start being able to gather better gender identification at that time. And then Eileen, did you have a question?
Oh, thank you. It was that was such important context, and thank you for reminding that about in this case about gender. And do we think that because I believe that this will also end up on the public-facing website, of having just a little asterisk that explains some of that for context, or to contextualize some of that data, if that could be helpful.
Yes, we actually can. And we did have something, but as we're rearranging the website, I think some of it has gotten a little shifted. And so we'll make sure that that is in a visible place within it and within the data. That is a great reminder. So thank you. I think we did have it on at one point, but I think as we're adding additional items, some things got bumped, but we do need to put that back in. And then age ranges. So this also shows, again, it shows the age range, both by numbers and by percentage. And of course, the main reason why we utilize 0 through 20 for that initial part is we have very few people who are under the age of 10. So from that standpoint, we would not be looking at it, but we're doing it in the decades because 21 is the start point for adult use. And so this way, just looking at the medical use, we go 0 to 20 and then 21 to 30 and then so on by decade in order to help with that. We also do have it by percentage so that we can actually see, are there big differences between the different age groups or among the different age groups? Just to let you all know, we also can, although it takes a little bit of cleaning up of the data, or as far as moving the data around, manipulating it, we can determine the age groupings in other ways if necessary. So if, for example, down the road, we say we want to know how many individuals are under the age of 18, so are still considered minors as far as the program, we can provide that as well. And then what we've also started doing is showing some of the trends. And so here we actually have the 5-year enrollment trends, which continue to show that since 2018, the program has essentially just continued to explode in many ways, with the number of patients going all the way from 53,000 patients now up to 135,000 patients. And while we have seen some slowdown, oh, actually, I'll get to that in a moment. And then we again have that data in graphic form, both in the numbers and the percentages. This way, especially for the general public who may be looking at this, they can see it in a way that actually is more beneficial for them. I think one of the things that helps us to be able to do from the program standpoint is to be able to see if there are major shifts with regard to particular qualifying conditions, so that that helps us determine if there's any issues, concerns, or problems that may be coming up within the patient population. And what I think is actually a little more helpful for us from a programmatic standpoint is we started looking and started including the 6-month enrollment trend. And so showing that both active patients over the previous 6 months, and as you can see, since December of 2021, the program has still grown by over 6,000 patients. So it has not really slowed significantly. We did see some slow, which we expected due to adult use starting, but we anticipate that will actually start to increase here pretty shortly. Once people start recognizing the tax breaks, quite frankly, of being in the program, we think we'll start seeing that increase. And then again, showing the most commonly enrolled qualifying conditions. And you can really see that on all 3 cases, these are pretty much straight lines. There's not very much deviation whatsoever on it. So looking at it from a 6-month standing, our enrollment by condition has been very consistent. And so that really helps to tell us that the providers who are enrolling are also being very consistent with what they do. So, but we have decided that rather than trying to do a PowerPoint, that we just take these slides and put them on, or these images and put them on a PowerPoint. We figured it would be much better for you to have access to these on a regular basis. They are on the website. We usually get them posted up within about the first week, sometimes a little longer if there are holidays, things like that, but within the first 2 weeks of the month, most certainly, that we have them posted for everybody to be able to utilize. It also is helpful, I think, from a standpoint, because you can go and see, let me, as example, you can see here, this is just 2022, but on this website, we actually have going all the way back to 2012. So there is a treasure trove. Of course, over the years, different data sets are actually utilized. For example, I'll just randomly pull one up from 2013, and you can see it's a very different format, but some of the information is very much the same. So the number of patients enrolled by county on here, the qualifying conditions overall, and of course, how many applications are in process at that time. We don't really count this at this point because that's not really the main part of what we're doing. In the very beginning of the program, earlier on, there were issues because of staffing issues, quite frankly, where the program was trying to get additional staff, didn't have it because of the volume coming in, and the staff were doing the best that they could to meet the statutory deadline, which is they had to have applications processed within 30 days. We still have that statutory deadline, but we have been below that for many years because we do have the staff and a fantastic staff that really help with processing that. So that 30-day issue has not been an issue for us with regard to it. But just to give you an idea, that's part of why those particular items used to be reported. And sometimes in some of the reports, you'll even see they'll say average time for processing of applications. And that was to be able to help people understand where it is. What we have actually done is we do have the average time for processing, but we do it as part of a counter on our main page, our main splash page. So what that looks like is right here. So it lets us know we update the information every day at noon. So this, of course, is based off of last Friday, and it shows what date the program is working on applications that have been received, and then for both the data entry side and for the ID card print. And as you can see, even with the holiday and even with this data being from Friday, we are still at only 14 days for people's cards actually being printed. So 2 weeks, and that'll get updated today. And chances are that will probably move and look more like the ID card print will probably be somewhere around the 11th or 12th. So anyway, so that's really all that I had this morning as far as an update from the program. Oh, I'm sorry, I almost forgot one other thing. We do also have one other aspect on this. We have an announcement, and we're very happy with this announcement today. We just posted this morning, is that we are launching our next survey of patients and providers. And that is actually happening partially as we speak. And so individual patients as well as providers. So any of you who also are certifying individuals, you may receive the email for this. It's being done randomly based on the providers and the patients that we have that are registered with the program. And so you may receive an email about doing the confidential survey. And so if you get it, please complete it. We're looking forward to seeing some of the results. And this particular survey is really about, from a patient perspective, it's about how much patients are using, what they're using, quantities, dosage, how beneficial is it? Are they using it not just for medical, but also for adult use or recreation purposes? And really asking a lot of more in-depth questions than we've been able to in the past. And once we actually have this data I think is going to really form a lot of the basis for this committee for the data moving forward on our patient population. So we're very excited and looking forward to seeing this. So, Gary, did you have anything to add? Did I miss anything?
No, that was quite complete. I don't have anything to add. Thank
Okay.
you.
Andrea, did I miss anything?
You did not miss anything that I can think of right now as well.
Okay. And any of the members of the committee, are there questions, things that, anything that you have really? Okay. Well, back to you, Eileen. Oh, go ahead, Eileen.
Well, I was going to say maybe two things, and one of them is that I heard you, I think that there was a lot of humility in all the work that you and your team have done, and thank you, because I heard you say, and that was just a few different times, but really that's a remarkable amount of work, and thank you for all of that. that we all, even though when we don't have questions, it doesn't, sometimes it can feel as though then the data is just sort of out there and then what? No, that was really remarkable and great work, and thank you for that. Yeah.
Thank
Yeah.
you. And we really are working at trying to get more pertinent data so that it can help inform decisions that are being made. Because really, surveys that have been done in the past, while there's been some questions about usage, this survey actually delves into a lot more about frequency and dosage and what is actually helping, what is not helping, side effects, things like that. With our very specific patient population. So I think that's going to be a lot more beneficial than these more broad-reaching surveys that we've done in the past, which, by the way, doesn't mean other people haven't done some of these similar in-depth data collection. But this is the first time that we're really doing it to this extent with dosages.
Thank you. And colleagues, maybe for others who are outside of the Department of Health and on the committee, what other questions do you have? There are no bad questions here. It looks like that Katie may have one.
I was just thinking on that one place where you show the time, the date, the data entry date, and then the card printing date. I'm wondering if a lot of patients might not understand what the data entry piece might mean, and if there could be like a parenthetical. You explained it to us really lovely, that like basically the time between the application and when you're processing applications, basically. But I'm not sure if it was as clear on the page.
So that's a great question, Katie. There is actually a note below that actually explains that there's 30 days for the program to approve it, and then that it takes up to 5 days to print in addition. So that is actually there. Honestly, though, what most patients, when they're looking at it, they're just looking at what date is my card getting printed. Now, if we were running into the issue where we were hitting close to that 30-day mark, that would very much be a problem. But so for example, what we notice is if we're any more than 2 weeks beyond someone submitting an application, we start to get a lot of phone calls from patients wondering where's my card, where's my card. So really what this is just for is to help alleviate and for people to have a place to go and see, wait, kind of where are they in their process. But and in the information on the application, it also explains a little bit about it. Well, I should say on the cover page for the application, it explains there wasn't enough room on the application itself for all of that. But it does explain there about what the process is a little bit. So we do have it in other places. And if we do ever start getting back to that point, which I really hope we never get there again, where we're approaching that 30-day mark, that would be very important to have. But at this point, mostly people are just looking to say, oh yeah, I submitted my card on about the 10th. I should be getting it soon. So, yeah.
Excellent. Thank you.
What other questions do we have, if anybody at this time? And if not, it's okay. We will be meeting again, right? It's okay to do this. Some thinking. So maybe none at this time. There was so much that was there. If you find at the end of the call that these questions do come back to you, then that is also okay, of course, also too. Something, Dominic, I have a question because I'm really excited to hear, I think you said this, but for the survey, and when do you think that we'll have the results of those?
Well, the survey's short. No, that's a great question. So the survey is deploying today. Of course, partly it depends on recruitment, how long that exactly is going to take. But I anticipate that we will probably start having some at least preliminary results by the next meeting. I think that's reasonable. It may not be final results, but I think we'll be able to have at least some preliminary results.
Okay, thank you.
Yeah.
Thank you.
That doesn't mean go schedule the meeting for tomorrow because we won't have the results by then. But
no, of course,
we
yeah,
follow
no,
the usual schedule.
Yeah, that was just a lot quicker than I expected. I admit. Yeah. And then One of the other things, and this is a very big question that I should have prepared you for before the meeting, which was when so it's okay to be like, that's a much bigger conversation than we can have right here. But when I think about the 8 different categories that our committee will be reporting back, it sounds as though some of the survey results will help advise like the educational needs and probably some things related to safety. Are there other, and then possibly, now I'm looking at the list, the impact of cannabis on alcohol, opioids, and possible other substance use. Is it anything that you can help me better understand about that? And then maybe I'll stop there, or about how it
No,
dovetails with that part of our mission. Thank you.
sure. That's actually great, Eileen. There are actually questions on there about whether or not cannabis use helps to reduce the use of other substances and is very specific with regard to opioids and alcohol. And we have several questions on the opioids side of it, to help really to be able to inform that more than just saying, oh yes, I reduced my opioids, but a little bit more than a few more questions kind of delving into behaviors with the individual patients. So hopefully we will be able to utilize that to be able to see a little more. In addition, and this dovetails in, although it's actually a part of a different role that I have within state government right now. For those who are not aware, I'm also the chair of the overdose prevention and pain management advisory council, and through that we are also working on looking at different potential ways of gathering information to be able to help answer some of those questions a little bit more. So there's many facets that are actually coming in to sort of dovetail together that will, I think, help answer some of those questions, or at least maybe it'll create more questions, because after all, isn't that the goal of research or the result of research? We don't actually solve questions, we just get more. So.
And I know that you meant that in jest, and sometimes we get question answers, but we'll see. But anyway, yeah, you're great. And then before we move forward to the next agenda item, anyone else with any other questions or comments? Compliments are also being accepted for the team. Okay, seems like
just one quick thing, and this is amazing information. Thank you, Dominic. The surveys are going to both the providers and the patients. Do you have any information, or is this addressed in the survey as to the role of the providers in patient care? Like, is it mostly primary doctors that are sort of following them throughout? What specialties are the providers that are caring for these patients? Is it sort of like they kind of see them once and then don't really follow them forward? I don't know if we have any information on that, but I would be really interested to see what their relationship is with the patients.
Yeah, there are some of those questions that ask in those areas very specifically, so that we can find out, what type of medical care is actually being provided, what are the specialties, and all of those areas. And obviously, I'm not actually providing too many details because I also don't want to potentially skew the study, as this is a public meeting. So, but there are things within that area. And I'm sorry, I should have said that earlier. That's part of why I'm not just like reading off some questions. So, but we do actually have questions in those areas. So, and as with any study, though, we're, of course, this is our preliminary. So I think we've covered a lot of subject areas within it, and a lot of the questions we've gotten over the last couple of years, trying to get at least some data. But we really see this as a preliminary study, that there will be more. And so even if we do miss some particular areas, and once we do start getting some of the data back from this, we of course will be very interested to hear what especially the members on this committee say, so that we can then in the future surveys start filling in some of those gaps and asking the other questions we need to ask. So.
Thank you. Anything else? See anybody whose hand is raised. So So thank you, everybody. And I also wish to, although I'm going a little bit out of order here, before we go to the next agenda item of the discussion of research and resources, something that I know that Dominic always brings up that I really admire is a land acknowledgement. And I think that in this case, I should have been the one to do so, and I didn't yet. And so very briefly, then what I'll just say is that this is the DOH ones. So on behalf of all of my colleagues who are at the DOH, right, then we all humbly acknowledge we are on the unceded ancestral lands of the original peoples of the Apache, Navajo, and Pueblo, past and present. And with gratitude, we pay our respects to the land, the people, and the communities that have and continue to contribute to what today is known as the state of New Mexico. So thank you for that, for giving me your time for that. And so the next issue on our agenda that we were to discuss was the discussion of research and also of resources. We started to talk a little bit about what some research is, and I think that this will be more, even more of a robust discussion. And at this point, although I have a lot of thoughts about this, I know I have a lot of opportunity to share mine. So maybe I will pause and turn it back over to Dominic or Gary.
Yeah, I'll go ahead and pick it up from here. Yeah, the purpose of this agenda item is to really sort of ask the board, how do you want to resource or where do you want to keep the resources that you want to access? I have received some articles from committee members, but the question is, where do we put those so that they can be accessed? About 2 meetings ago, we talked a little bit about using a SharePoint interface, but I think we were running into some issues with that. We talked about Zotero a little bit. And I can honestly tell you that here at DOH, we have been doing IT upgrades and changes. It almost seems weekly. So again, there's been a lot of flux there. But what are people comfortable with? And then how do you want to disseminate the information? If you prefer just send it all out in email form before the meeting, or if you want to have a repository, we want to help facilitate that with clear instruction so that themes can be addressed in the meetings, topics can be really fleshed out. And so, yeah, we're here to help. And I just wasn't sure if members had the chance to go to the Zotero site that we had sort of initiated, or use that, or if there's just like a Google, a Google group might be better. So again, I'll leave that up to y'all to sort of discuss and see, what we come up with.
So Gary, thank you so much for that. And this is Eileen. And I wonder if one thing I wish, I'm going to spring it on you and I apologize, but I wish I had thought of this, which is that if it could be helpful if just while we're all here, if one of us were able to go to that site, share screen, and just give everybody visually, in case they weren't able to take a look, that everybody just gets a sense of just that we're all on the same page, if you will. So I don't know if, I think that I'm not able to share mine. I don't know if anybody else is in a, if you or one of the colleagues are able to do that. And perhaps it's unnecessary, in which case I completely understand.
The link I have, I just put in the chat. But I myself have not utilized it really since we had set that up at that time. So I'm not sure if
I'm working to see if I can jump into mine right now, but and I do have to apologize for those who are not with the state right now. DOH is transferring a lot of our systems, so our logins are being very finicky, and sometimes we have to log in with one ID, sometimes with a different, and it is blocking me right now from jumping in to the Zotero. So I'm trying to just get that reset. So my apologies on that. We hadn't thought about from that standpoint.
I ran into the same thing. So, but is Zotero the format that people want to use? Maybe that's the question we also have. I know that the UNM individuals probably have a wealth of knowledge using Zotero. I'm more proficient with SharePoint, I'd say at this point. Or do you prefer to disseminate information a different way?
I mean, I think me personally, like I've just had to adapt to using a lot of different systems, and that's fine. So I think, you know, whatever is the preference of the Department of Health. I think Zotero is nice because it is free and you know, works with other referencing systems. So to the extent that we're mostly collecting articles that might eventually be cited in a report, it'll make it pretty seamless to use the Zotero articles that we collect to kind of plug them into the report. And again, it's free. I also use Mendeley a lot, which is also free, but it's Elsevier, owned by Elsevier, so it's less might be less ideal from that perspective, because it's not open source as much as Zotero is open source. It's proprietary, even though it's still free. But I think what I like about Zotero or Mendeley or EndNote or whatever we decide to use is that, you know, it does provide that opportunity to store articles in a way that will allow us to cite them in a document, but also store them with a PDF, and you can put comments in them, I think, as well.
Great. And I was able to log in, so you should be able to see kind of what we've set up here as far as with that. We had gotten several articles that Libby had put in for us prior to her leave. So we have that, as well as Kathy, I believe. So, and Kathy's actually the one who set up our particular group site. So
For whatever reason, I was not able to get in. It says access is denied.
oh,
That was true for me as well. I don't know if it needs to be shared. It says that you can only look at it if you're a member.
okay.
Yeah, I think, Dominic, where we left it is that we were getting the library set up and populated with a few things. We need to invite the membership here to that library. So I'll take that action to get that set up.
Okay, thank you, Kathy. We appreciate that. And I think now that you say that, I do recall Libby was working on some of those aspects shortly before her leave. So that may be one of the things that we have, with all of the other changes that are occurring at the moment, we may have be a little delayed on. So our apologies on that. But I do think that part of our question really was if this actually is a good forum for the sharing for the journal articles, and really knowing before we started sending out just lots of invitations for all different kinds of sites, if this really would be a preferred method or if this would be acceptable. And I think that's what we kind of needed to know.
Are we discussing a platform both to share the articles and to ultimately jointly write the document that we're going to produce? Or is this really, I'm not familiar enough with Zotero to do we also write on Zotero?
No, it's linking into Zotero for that citation aspect of it. So this is really for the document sharing and being able to do that. As Katie had mentioned, you can put notes in, you can share links. So some of the documents here, for example, are actually links. So they go back to the original websites for setting that on up. So this is really the platform for sharing all of that documents. that we can later use for the linkages and citations.
Dominic, this is Eileen. Something I hadn't thought of before now, and this is yet another thing I'm springing on you, is whether we think, if we decide to stick with Zotero, and I'd love to hear other people's thoughts on that, but regardless of what platform that we decide, could there be benefit to us having subfolders that are in the 8 domains that that our report will end up being in, so that could help us help information be sorted. It can also help us identify what could be additional information that we and additional data that we could be seeking out to round out to ensure that we're meeting the needs of the report that will be written and setting us up for success there. Does that make sense?
Sure. It makes complete sense. And actually, we are on, so to speak, the same page. If you actually look over to the left-hand side of the screen, or at least I'm hoping it's the left-hand side as you're all viewing it, you will actually see there are those categories listed there. And so you could go into them. We had not started really moving very much yet, but if like here, I know on the child and infant safety, I knew we had at least one item in. So you can see we have started moving items there. Kind of what our idea was is that the articles would initially get linked in this main folder, and then as people review them, they can then be put into the appropriate categories. And that sometimes may be, you know, Eileen, for example, if you have an article, you say, this one is definitely about pregnancy, I'm just going to move it directly into that folder. Sometimes it may be multiple categories. That's where putting notes is helpful, because then we might be able to say, this actually falls into several different categories, and kind of working through it that way.
Well, that is high praise for you to say that I'm on the same page as you. I am a little bit mortified that I had scrolled over to the right, so I missed it on the left. I am sure that where that came from was because it was, it planted the seed when you said you were going to do it. So thank you. Yeah. So with that, I haven't heard a whole lot of comments about if we heard from Katie a couple different ideas there. I haven't heard any other, maybe I'll say, concerns about using Zotero now that we know that there is some work coming up about ensuring everybody has access. With that in mind, it seems like there's 2 things that we could do. One of them would be maintain this for now, ensure everybody has access, and then have that as an agenda item for next time to see how are people's experiences and if we should make any changes. That seems to me something that we could do instead of right now us sort of guessing. I think everybody probably wants to have a little bit more opportunity to explore. Does that sound like a reasonable strategy? So the other thing we could do is just make a decision now, just from the work that we can see from the screen that Dominic is sharing. So maybe specifically what I'll do is I'll make a suggestion and I'll look for people to disagree or to agree, which is I'll suggest that that we keep using Zotero right now, and that at the next meeting we reassess after everybody has had access. We ask in your busy time that you try to find some time to poke around, explore, also to supplement, right? We all learn from each other. And then we can make if we need to, then make a different decision at the next meeting. Thank you, Eleni, for your feedback.
So I think, if I may, I would offer, Dominic, that given the recent changes that IT has been making with regard to some of our applications and access, that we could also revisit the option of a SharePoint site for this group. I heard mention of being able to kind of co-author the documentation for the recommendations, et cetera. And so that would certainly help to facilitate that process. I think that these recent changes will probably allow us a little more flexibility than existed previously. So I'll take that action as well.
Thank you, Kathy. And for everybody else, what's kind of happening is the department and actually all of state government is moving towards some more unified data sharing systems. And one of the things with SharePoint and why we actually had not even suggested it previously is we could not actually share outside of with individuals outside the agency or outside of state government. So that was part of why we had not even brought that up. But we can definitely continue to explore that. And that may also be a supplemental system for that, where Zotero can continue to be the citation resource program, where SharePoint could be utilized for writing the actual documents.
Yeah.
Okay. So Kathy, it sounds to me, and correct me if I'm wrong, Eileen, but it sounds like there was unanimous consent with regard to that last motion. So if that's the case, Kathy, if you can get everybody access to through Zotero, that would be great.
You got it.
Thank you.
Thank you. And then with that, of course, as we start to get toward wrapping up the meeting, that first will be any other items from committee members that you wish to have us discuss or to consider. And I have one thing that was forwarded to me by Gary that I didn't know if he wished to address with the group. I'll defer to your judgment about the article about insurers, and but also to see what are other thoughts and contributions, questions from the entire group. All of your voices matter here.
And Eileen,
Yeah.
just sorry to interrupt, but Alan was able to join us a little bit ago.
Oh,
So he's been on the screen. It happened while I was sharing, so I know sometimes that will squeeze some of the video lenses out. So Alan has been here with us for a little bit. So yeah.
Thank you. And then so maybe while people are thinking about their additional items, then we'll welcome Alan. Thank you also, Dominic, for saying that, and Alan, Eileen Barrett. And one of the things that we're so grateful to have you here. One of the things that that we would like to learn from you, which we all shared with each other, is your name, your role in the committee, where you're calling from today, and your favorite burrito in New Mexico. And you're not alone in sharing those things. Oh, and pronouns. That's a lot to ask.
Okay, hi. I was just trying to get my volume a little bit better. I guess I'm hard of hearing today. I turned out positive for COVID, and so I'm working from home, isolating. Not something that I like, for sure. But I couldn't hear quite all of the things that you were asking me about. So if you repeat those, I'll try to do them.
Thank you. So where you're calling? So I'm so sorry that you have COVID. I hope that you have an easy and full recovery. And we would love to know where you're calling from today, your role in the committee, and your pronouns, and your favorite place to get a burrito in New Mexico.
Wow, interesting. I'm in Deming, calling from home, actually. What I usually do on these calls. I usually go to a couple of different places here in Deming for burritos. The one called Irma's and one called Si Senor. They've long-term establishments that are part of the Southwest. You just love them. Or to anything anybody calls me.
Thank you, Alan. I think some of the audio did cut out for a little bit, but we did get to hear a little bit about and from you. And so thank you, and we're glad that you're here. Yeah. And colleagues, what other oh, and maybe I'll go first to Gary, did you feel like that that there was information that we should discuss as a group that's informational?
No, it was more just, again, bringing to your attention, there's the articles and then there's current events as well. And just, I think the board or the committee rather is going to have the opportunity to discuss a lot of different things. And maybe just, with regards to, are there themes that the committee wants to address each meeting, or just sort of an array of articles and just how to categorize that? And so, no, it was nothing explicit or distinct, but just, just sort of putting it out there more.
Thank you. And I think that with that in mind, probably maybe you had shared an article with me about in the realm of our current events that I'll put in the chat so that everybody has sort of a shared understanding what we're saying here. And it's an article from the Journal about a lawsuit about out-of-pocket expenses for people who are in the medical program and their out-of-pocket expenses to be able to treat their medical, their behavioral health diagnosis. And I think that introduces the bigger question that Gary brought up, which is for everybody to answer, everybody to weigh in on, is that what are your thoughts for to what extent we wish to share information about our current events in the landscape here in New Mexico or nationally, or to what extent we wish this sort of data sharing now that we'll explore through Zotero will be about more of like scientific medical articles. Do we wish to also share with each other the lay press articles about current events too? Or what are your thoughts and recommendations?
I think we should share the lay press articles as well, because the goal of this committee is to ultimately inform policymakers who are working for the public. And so I think it's important that we be aware and that they be aware of what the public is thinking and seeing in the news.
Thank you, Lenny. I think that you said that really well. I couldn't have said it better than you. I'll ask if anybody has any concerns about us doing so. Some that certainly aren't coming to mind to me, I'll be honest. I think that I agree with everything that Eleni said. So it sounds like none. So so looks like that is something that we will look to as well. So thank you. Thank you.
Should we create a folder for maybe like lay press or current events, or should we, do you think, subcategorize it into sort of the categories that we were talking about before?
Sure. My bias is for the subfolder, but I would like to hear everybody, other people's thoughts, including yours.
I think it could go either way. I don't know what other people think.
The subfolders, I think, is a good idea.
And to make sure that I understood, is that having a separate subfolder or putting them in the existing subfolders in the category in which it belongs?
Eileen, was your bias towards a separate subfolder or to the subfolders that already exist?
Oh, I was thinking a separate subfolder, but I think the fact that it's there is more important to me than where exactly it goes.
I think separate subfolder might be helpful as well, just in terms of like a subfolder that's kind of lay press, and then have all our medical and scientific into separate folders. I don't know if that's what Matthew had in mind.
I'm fairly flexible either way.
I guess maybe what we could do is we could just try it, and then if it looks like it isn't meeting people's needs, then we can always change it. Thanks. Thank you, everybody. Thank you, Lenny. Thank you, Matthew.
And Eileen, just to let you all know, I just created a subfolder in there for current and recent news articles.
Look at this action-oriented group. Excellent. What are some other needs, preferences, questions, concerns that that you have while all of us are together? If any. Maybe none at this time.
None here.
Should we conclude our meeting? Oh, we need to set the time for the next meeting, of course. So of course, knowing that that will be in about 2 months. Perhaps in general, then I'll ask if there are concerns about this time slot, meaning specifically the third Tuesday of the month, starting at 10, which would put us at the August 16th at 10 a.m. Throwing it up for a start.
I would not be able to make that one.
And just as a note, I would actually recommend going into September, only because the end of summer, and especially that time in August for anyone who's connected with the university, becomes an extraordinarily busy time because of the start of the semester. So, and it's a insane couple of weeks, to say the least. I think that would be an appropriate way. So it might be better just to extend this one until September.
Okay.
And I saw Katie nodding her head yes.
I think that's a great suggestion. With that in mind, then again, thinking for a Tuesday, thinking of at 10. I know I wouldn't be able to make it on the 20th. I apologize to that. So maybe I'll ask about the 13th. So that's the second Tuesday. Okay, I see one thumbs up from Eleni. Dominic is smiling. I think that's a good sign. He tends to smile. And ask, go ahead, please.
And I do see Katie's got her thumb up and Alan is nodded his head. So it sounds like that's good.
Okay, excellent. Gary, will that work for you also? I suspect that you probably indicated and I missed it when I was scrolling.
That's great. Yes, that will work very well.
Okay, thank you. Great.
I missed the time. What was the time?
10 to 11, 10 a.m. The same time slot as the last couple. Does that work for you, Matt?
Yeah, that'll work for me. Yep.
Yeah, it works for me too.
Okay, excellent. Then I think that we're set. With that, then I think that it probably is time to conclude the meeting. And again, I'll thank everybody. I hope that your day has unexpected kindnesses and graces, and that everybody is you do something that's good for yourself today, because I know that you're being good to others. And maybe just before everybody leaves, and we'll see if Dominic has anything that he wished to, anything I didn't think of that he wished to say.
I just want to thank everybody for all the work that you're doing. I know we are just still in many ways getting started. I know these types of committees take a while, so we appreciate your patience on it. And Eileen, also want to thank you for stepping in today. We really appreciate it. Thank you so much. And if there's anything that we can do to help for any of you, please let us know. So thank you. And I hope you all have a great and wonderful day. And hopefully we'll have a little more rain.
And stay tuned for the Zotero invite email. We'll be getting that out to you. And if you don't receive it, or we don't hear from you that you have received it, please reach out, contact me, and we can get that to you, of course.
And yeah, I second the prayer for rain, and check your spam mail when that goes out, because it might go to spam.
All right, well, I'm going to go ahead and conclude the recording, and thank you all for your attendance, and September 13th.
Good to see y'all.
Thank you. Good to
Good
see you
to
all.
see you. Thank you.
Thank you,
Thanks,
everyone.
everybody. Everyone, take care. Be safe.
You too.
Bye.